fertility preservation, counseling and patient education, informing patients about options, success rates, and risks. Fertility preservation is a crucial process for individuals who may face the potential loss of fertility due to medical treatments, e.g., chemotherapy, radiation, or other circumstances, e.g., aging, genetic conditions. Counseling and patient education play a key role in helping individuals make informed decisions about their fertility preservation options. This process involves discussing various available methods, providing information about success rates, and outlining potential risks. 1. Importance of counseling in fertility preservation. A. Psychological and emotional support. Mental health considerations. The decision to undergo fertility preservation is often emotional and can be stressful, especially for individuals who are undergoing medical treatments, cancer treatments, or dealing with the potential of future infertility. Counseling should include mental health support to help individuals cope with the emotional burden of fertility preservation decisions. Personalized counseling. The counseling process should be personalized, taking into account the individual's unique medical situation, life plans, and emotional readiness. This ensures that the patient understands the full implications of their decision. B. Patient education. Informing about options. Patients must be informed about the different fertility preservation methods available, including egg freezing, oocyte cryopreservation, sperm freezing, sperm cryopreservation, embryo freezing, embryo cryopreservation, and ovarian tissue cryopreservation. Tailored recommendations. Recommendations should be based on the patient's age, health status, and personal goals. For example, younger patients may opt for egg freezing, while patients undergoing treatments like chemotherapy may consider sperm freezing or ovarian tissue preservation. 2. Explaining fertility preservation options. A. Oocyte egg cryopreservation. What it is. The process of freezing a woman's eggs for future use. This method is commonly recommended for women who are not ready to have children but want to preserve their fertility for later use. Indications. Women undergoing medical treatments that may impact fertility, e.g., chemotherapy, women with certain genetic conditions, or women who choose to delay childbearing. Success rates. Success rates depend on the woman's age at the time of egg retrieval. Younger women generally have higher success rates, while women over 35 may experience a decrease in egg quality and quantity, which impacts the chances of successful fertilization and pregnancy. Risks. Risks include ovarian hyperstimulation syndrome, OHSS, complications from egg retrieval, e.g., bleeding, infection, and emotional stress related to the process. B. Sperm cryopreservation. What it is. Freezing sperm for future use, typically used by men undergoing treatments that may affect their fertility, such as chemotherapy or radiation, or those wishing to delay fatherhood. Indications. Men with cancer, those facing surgery or radiation affecting reproductive organs, and men seeking to preserve fertility before gender-affirming procedures. Success rates. Sperm cryopreservation has high success rates, especially if the sperm is of good quality at the time of freezing. Success depends on sperm quality and the method of insemination used later, e.g., IUI, IVF. Risks. Risks include the potential for sperm damage during freezing and thawing, as well as psychological concerns related to sperm banking and future use. C. Embryo cryopreservation. What it is: freezing embryos created through IVF using either the patient's eggs and sperm or donor gametes for future use. Indications: often recommended for couples undergoing fertility treatments or individuals who wish to preserve both eggs and sperm for future insemination. Success rates: embryo cryopreservation tends to have higher success rates compared to egg freezing, as embryos have been fertilized and can be monitored for development before freezing. Risks: risks include the same as egg cryopreservation, plus potential complications with embryo thawing, fertilization, and implantation. There may also be ethical concerns related to embryo storage and future use. D. Ovarian tissue cryopreservation. What it is: the process of removing and freezing ovarian tissue, which can be reimplanted later to restore fertility. Indications: typically used for younger women or those whose ovarian function may be compromised by medical treatments, such as chemotherapy, or those with conditions like premature ovarian failure. Success rates. Success rates vary. The procedure is still considered experimental, with ongoing research to improve outcomes. Risks. Risks include complications from the surgical procedure, potential failure of reimplantation, and the possibility that ovarian function may not be fully restored. Third, success rates of fertility preservation. A. Factors affecting success. Age. Age is one of the most significant factors affecting success. Women under 35 have the best success rates, as egg and embryo quality decline with age. Men also experience decreased fertility as they age, but this is less pronounced than in women. Health status. The overall health of the patient and the reproductive health, e.g. ovarian reserve sperm quality, will affect the success of preservation methods. Method used. Success rates vary by method. Embryo freezing generally has higher success rates than egg freezing, which in turn is more successful than ovarian tissue cryopreservation. Storage duration. The length of time the preserved material is stored may impact success rates. Material that has been stored for longer periods may experience reduced viability, though advances in cryopreservation techniques have improved outcomes for long-term storage. Bachelor statistics and data. Egg freezing success rates. Success rates are highest when eggs are frozen in younger women under 35. The chances of pregnancy decrease as the age at freezing increases, particularly after 40. Sperm freezing success rates. Generally, sperm freezing is a very successful method with high success rates, especially when sperm is of good quality and the method of insemination is appropriate. Embryo freezing success rates. Embryo freezing has success rates similar to those of fresh embryo transfers, with success depending on the embryo's quality, the woman's age, and the method used for thawing and transfer. Ovarian tissue freezing. This method has lower success rates, but there have been successful pregnancies reported, particularly when tissue is reimplanted at a younger age. Fourth, risks of fertility preservation. A. Medical risks. Ovarian hyperstimulation syndrome, OHSS. OHSS is a potential risk of egg retrieval when ovarian stimulation medications are used to increase egg production. It is a rare but serious complication that can cause abdominal discomfort, fluid retention, and ovarian damage. Invasive procedures. For egg and embryo retrieval, invasive procedures like aspiration and ovarian surgery can carry risks such as bleeding, infection, and damage to surrounding organs. Long-term risks. There are no known long-term risks for most fertility preservation methods, but further research is needed to assess the effects of long-term storage and reimplantation, especially with ovarian tissue cryopreservation. B. Psychological and emotional risks. Emotional stress. The process of fertility preservation can be emotionally taxing, especially when patients are undergoing medical treatments like chemotherapy. Patients may also face anxiety about the possibility of using their preserved material in the future or dealing with the uncertainty of success. Impact on future family planning. For women who delay pregnancy through fertility preservation, there can be psychological stress and regret about the decision, especially if the procedure is unsuccessful. 5. Communication strategies in counseling. A. Open and transparent communication. Counselors should foster an open environment where patients feel comfortable discussing their concerns and questions. Clear and transparent communication is key to ensuring that patients understand the benefits, risks, and limitations of each fertility preservation option. Realistic expectations. Counselors should provide realistic expectations about success rates, potential risks, and the uncertainties involved in fertility preservation. They should also address any misconceptions or fears the patient may have. B. Decision-making support. Patients may have difficulty deciding on a course of action due to the emotional and financial investment in fertility preservation. Offering decision-making support, such as providing information about all available options and discussing the pros and cons, is essential. Certificate of referral for additional support. Counseling may involve referrals to other specialists, including reproductive endocrinologists, mental health professionals, or financial advisors to address all aspects of fertility preservation and ensure the patient's well-being. Conclusion: fertility preservation is an important option for individuals who wish to protect their fertility in light of health issues, aging, or personal choices. Comprehensive counseling and education are essential to ensure patients make informed decisions, understand success rates, and are aware of the associated risks. Providing realistic expectations, psychological support, and ongoing communication are key components of the counseling process.